How do you treat hypertrophic scars after surgery? Imagine looking at a scar and wishing it was less noticeable or less itchy. Many people face this challenge after surgery, especially if the healing process didn't go perfectly. So, how can you improve the look and feel of these scars? Let's explore some effective ways to manage hypertrophic scars and help your skin heal better. After surgery, your body naturally forms scar tissue to close the wound. Sometimes this process produces a raised, red, or pink scar that stays within the original wound boundaries. These are called hypertrophic scars. They can be firm, itchy, and sometimes painful. The good news is that with proper care, you can reduce their appearance and discomfort. The first step in treating hypertrophic scars involves applying silicone products. Silicone gel sheets or creams are widely used because they help hydrate the scar tissue. Keeping the scar moist can soften the tissue, reduce redness, and make the scar flatter over time. These products are simple to use at home. Just apply them daily and follow the instructions. They are safe for most people and often the first treatment recommended. Pressure therapy is another option, especially for scars from burns or large wounds. Doctors might suggest wearing pressure garments or dressings that apply steady pressure to the scar. This pressure helps flatten and soften the tissue. It is most effective when started soon after the wound has healed and can be worn for several hours each day over weeks or months. If the scar remains raised and bothersome, corticosteroid injections can be helpful. These are given directly into the scar tissue and can reduce inflammation, itching, and size. Multiple injections may be needed, spaced every few weeks. While effective, they can sometimes cause side effects like skin thinning or color changes, so your doctor will monitor your progress. For more stubborn scars, laser therapy offers a good solution. Laser treatments target the blood vessels feeding the scar, which helps reduce redness and flatten the tissue. Laser can also help with itching and pain. It is usually used if other treatments haven't worked well or for particularly thick scars. Cryotherapy involves freezing the scar tissue with liquid nitrogen. This method can help flatten raised scars, especially when combined with steroid injections. It is often used for smaller scars and can be quite effective. If other options do not work, surgical removal might be considered. However, surgery alone can sometimes cause the scar to come back as hypertrophic. To lower this risk, surgeons often combine it with other treatments like laser therapy or radiation. In rare cases, low-dose radiation therapy is used after surgical removal to prevent the scar from returning. This is not common because of potential side effects, including changes in skin color and small risks of other complications. Other treatments include topical medications like creams containing onion extract or anti-inflammatory agents. These may help soften scars and reduce symptoms, but their effectiveness varies. Microneedling, which uses tiny needles to create controlled injuries, can also remodel scar tissue and improve its appearance over time. To get the best results, start scar care as soon as your doctor says the wound is healed. Be consistent with your treatments, whether applying silicone sheets, wearing pressure garments, or attending appointments for injections or laser therapy. Protect the scar from sun exposure by using sunscreen or covering it when outdoors, as ultraviolet rays can darken the scar and slow healing. Keep an eye on the scar for signs of infection, increased pain, or sudden changes, and report these to your healthcare provider promptly. Remember, no treatment can completely erase a scar, but most can significantly improve how it looks and feels. Results vary from person to person, and some scars may need a combination of therapies over months or even years. If you're worried about hypertrophic scars after surgery, know that options are available. Starting with simple treatments like silicone sheets and consulting your doctor about other therapies can make a big difference. Patience and consistent care are key to achieving the best possible outcome.